A wonderful good morning Wednesday morning to you. It's exactly 9 o'clock in the studios of Classic 105.5 and 105.9 on the FM band. As I say, good morning again to our viewers. Those of you just joining us on GBN's Channel 7 and Channel 11, Channel 20 if you're in cable. If you're following us via the World Wide Web at www.gbn.gd or via our Facebook page or YouTube channel. Welcome to today's edition of To The Point for today, the 13th day of the month of October. Another great day in God's wonderful creation. And indeed, it's a pleasure being here with you. And certainly happy that you've chosen Classic and to be part of today's conversation. And this morning, my guest is a district medical officer for St. Andrew, and she's Dr. KerryAnn Renaud. And this morning we'll be talking and we'll be talking all things as it relates to Medcare, what's happening in St. Andrew, what's happening on the district level. Very often we've heard about these district medical officers, and we talk about preventative health care, and you continue to hear our health officials say that it starts at the district level. Getting to understand and appreciate what is happening on that side and that neck of the woods. So at this time I want to say good morning to Dr. KerryAnn, and again, she is the District Medical Officer of St. Andrews. Good morning, Doc. How are you?
Good morning, Mr. Cadore. I'm fine, thank you. How are you?
I am wonderful, and I'm assuming that you're managing to stay COVID-free, good health, all is well with the family.
Yes, that is correct.
For the purpose of today's conversation, let's first define your role so persons can understand and appreciate the context of today's conversation. So you're the District Medical Officer for St. Andrew. What exactly does that role encompass?
All right. So as a District Medical Officer, my responsibility is to manage the health care of patients at the community level. So we're talking about chronic disease, we're talking about acute care, we're talking about our shuttings, we're talking about people that need dressings, we're talking about vaccination clinics, we're talking about child health, maternity clinics. So together with the nurses, at the community level, it's really our job to ensure that community health on all levels are taken care of.
Certainly, as a doctor, healthcare is what you're trained to do. But let's talk about what's happening within your district, specifically St. Andrew. We continue to hear a lot about different healthcare issues. COVID being chief among them. We continue to hear about these other communicable diseases, and that is creating a havoc. What can you tell us about the general state of healthcare within your district?
All right. So currently, as you stated, COVID has taken over everything. So presently, we have reduced services being provided. So some of our smaller medical stations are closed, and we're providing care out of the Granborough Health Center mainly. So myself and Dr. Nichols, who is the other district medical officer, are trying to manage that. We're having our child health, our maternity health, and so on as normal in the smaller community centers, but the DMO clinic and the chronic disease clinic is centralized to Granborough at present because we want to be able to be at that central location to oversee the COVID matters as well as pay attention to our regular patients because they too need attention.
But there are those who would ask, though, I would question the move. As I said, during regular, when it's all nice and calm, you have, now that we're in a pandemic, you're seeing that you have less locations available. Some would question the logics to that. What's the rationale for it, though? You made mention of centralized location, but people will be thinking, listen, I want to be able to see a nurse or doctor right where I am.
The thing is, with the pandemic and the volume of patients we're having and the number of things we need to be doing, we don't have sufficient staff to spread thin at all of the medical stations as well as do the COVID coverage. So with everybody working from central spots, we're able to do more. I think if we try to stay at the smaller locations as well, we wouldn't be doing the public a justice, because we wouldn't be able to serve them and do what we need to do. So for instance, when we're at the Grand Bras, let's say on a Monday, we have COVID testing, we have vaccination, we have DMO clinic, we have all of these taking place all at once. So whilst I'm doing DMO clinic, if a COVID patient comes in for testing and they need assessment, I can easily be called down to do that. Whereas if on Monday I'm at a smaller station and there's a COVID patient that needs assessment in the clinic, then we'll have to depend on the hospital, which is already overwhelmed. So in terms of managing the resources we have available to us now, it makes the most sense to have everything done centralized.
Before you move, what is DMO though?
A district medical officer, I'm sorry.
Oh, okay. So that's exactly what I wanted to make sure that we're both on the same page. And for the persons that is listening in, so it is basically a strategic decision in terms of for management purposes. Why you've actually done that?
Yes, because with 2 DMOs in St. Andrew, for instance, one day I could be out doing visits to the shuttings, the chronic disease, and the COVID patients that need home visits, while the other one is at that central location managing what's happening there. Whereas if we were to spread thin, I may not be able to do the home visits. I may have to go to one of the smaller stations. He would have to be at his station, and I will be doing the public less of a service that way.
What is the experience?
For the moment, it was best.
What has the experience been during COVID, having strategically decided to work out of the Grand Bras station, and looking at the pandemic as it is, the impact it has had? What has it been like for you and your team in the St. Andrews district?
Well, St. Andrew is the biggest district in Grenada, so it has been challenging. We've had to do so much all at once. We've had hundreds and maybe thousands of home patients. When we have testing clinics before this week, when everything is less, we've had hundreds of persons line up to be tested. We've had people fainting on us. We've had persons we had to call the ambulance for or get into our own vehicles and rush to the hospital. So within the clinic itself, it has been crowded sometimes and overwhelming for us, trying to divide everybody, separate the sick from the not sick, ensure everybody gets care. Added to that, my nurses have been going out daily. So even if I don't go out, the nurses go out and they report back to me and let me know, well, doc, this patient needs to be seen. So then I have to find some time to leave what's happening there to go and see that patient and make sure that everything is done best there. So it's been a lot of multitasking, really, a lot of multitasking.
Let me just share this with you, because very often it is always easy just to throw at you the negativity that comes from the general public. But this message had come in bright and early on social media. This person says, "Good morning, Doc. Thank you for the wonderful professional service you are doing. Especially we can call your team at Grand Bras Medical Station and the COVID team from day one. We really appreciate you guys and the exemplary service you provide. Please, Grenada. Okay, let's just start. Okay, so Grenada has you have a well managed team, and about visiting every nook and cranny, they applaud you for that. We love you from the bottom of our hearts, risking your life and family to care for us. Again, the best. Savoring her patients with her professional care." And so I guess maybe it's always good that we can say hats off to the team. And it's always good, I know, I'll leave you to comment on that if you wish, but it is always good when, and I can see the smiles on your face, when you know that what you're doing isn't in vain and people do recognize it.
Yes, it is. The small little thank yous go a long way, because this is hard. It becomes overwhelming. There are many days when I don't eat. I forget to eat. It's the next morning I remember, I didn't eat yesterday. Or when we lose a patient that we tried hard to save and we cry. So it does get very hard. We get frustrated. Sometimes we may be a bit harsh in the way we speak. Sometimes we will not be able to answer all the phone calls or respond as needed, but we do try our best. So when somebody takes the time to say thank you, it means a lot. And the truth is, we've had a lot of support from the public. We've had private citizens of St. Andrew bringing lunch for us, bringing water for us, bringing cases of Gatorade and malt for us. So the appreciation is there, and I'm grateful that people are taking time to say thank you for what we're doing.
While we're on that note, though, as you talk about dealing with the dead, seeing the sick patients, sometimes we take for granted the services that's been offered by our frontline workers, which include, of course, a number of people, doctors, store clerks, and a whole host of different individuals. But you talked about you're running day in, day out, you have a family of your own. There is the ongoing conversation about mental health. And you as a doctor, the frontline workers, medical team, having to go and come every day, but not lose it upstairs. How has that been for you as a doctor?
Some days are harder than others. I am forever grateful that I have a very supportive family. My husband is always there to help when I need a driver, when I need him to look at my son. And my son is 4, but he is understanding of the situation. When I come out from seeing patients, he doesn't allow me to get into the vehicle without sanitizing my hand. He doesn't touch my phone. And I'm grateful for having a supportive family. They know when days are hard, and they let me be. And then I have an excellent team in St. Andrew. The nurses are awesome. My community health nurse, Nurse Thomas, she carries a heavy burden and she informs me of what is necessary. She doesn't overburden me. My colleague, Dr. Nichols, as well, we share responsibility very well. So all of that helps my team and my family. But it does get tough. There are days when you just think, why am I doing this tomorrow? But then you wake up and you're instilled with new motivation because you remember you're serving your people and we need to get out of this. So it does get tough, but we manage.
And I'm happy that you're saying that, because it is important very often. It's not too often we get to see the softer side of our healthcare professionals. Very often it is easy for us to chide them, to bash them, and you complain about everything else. But some at the end of the day, we do have to remember at the end of the day that you're no different from you and I. From me, you have a family, you have a young son to take care of, and certainly we applaud you. Now let's talk about healthcare. Get into what's happening at the district level. We talk about it as COVID. Yesterday, though, one of your health professionals was highlighting the fact that while, yes, we've seen a reduction in the number of active cases. Yesterday, there was just 17 registered active cases, and it takes the total number, it is reduced. I can't remember the exact number I gave it this morning, though. Health officials, though, have seen an uptake in the number of persons being admitted to the hospital with other chronic underlying conditions, be it hypertensive cases, diabetic cases. Let's talk about that in terms of your experience at the district level and what you have observed. Let's talk about that.
All right. So generally, it's hard to get a lot of our patients to be compliant with their management plan, their diet, their lifestyle, their medication. Now that we're in the pandemic and a lot of our services have changed, it has gotten even harder. So whereas I would have gone to a smaller station and have been able to see my elderly patients and talk to them, monitor their pressure, monitor their sugar, I can't do it as I would have liked now. So the challenge to get them to do what is right is even harder. We do try to reach out to them, ask them to send their family members for their prescriptions. We've actually delivered medication to a lot of our patients because we don't want, especially our elderly ones, coming out to the station and being exposed. But the culture is one where we think that we don't need medication. So now that there's an opportunity to not get the medication, not take the medication, not be harassed by the nurses and the doctors to take the medication, people are doing that. And what is happening is that we're seeing that the diabetes become uncontrolled because they're not taking the medication and they're not monitoring. They're not checking the blood pressure, they're not taking the blood pressure medication. So all of that is spiking. And then there is the anxiety and the stress of the whole COVID situation that tends to decompensate these chronic diseases. So it's a mixture of factors that makes everything a little worse right now as we come out of the lockdown period. The hope is that as things are getting better and we will be able to open back up our smaller stations and see more people, that we can get people back on track to where they were. It's a whole education process because, like I said, that I started, it's hard to get them in normal times, a lot of them to comply. So all of those factors are part of the reason why Dr. Noel and team are seeing the upsurge in admissions for chronic disease at the hospital.
That is indeed quite interesting. But you made mention of the fact, you highlighted the fact that there seemed to be this general hesitation against taking medication and that sort of thing. What, in your estimation as a professional, drives that sort of hesitation or reservation among individuals? If you know you're sick, you have a condition, a predisposed condition, you have medication, just take it. Why are there apparent hesitation and all those sort of things in your mind?
I think it's partly cultural, where we believe in natural remedies, we believe in herbs, we believe in the bush medicine. And personally, I tell my patients, okay, you're going to take the herb. You rather use the herb than my prescription. But let's not just use the herb and forget what I say. Let's use the herb and let's monitor. Let's see if the herb is working. And if it isn't working, then let's give what I am prescribing a try and let's see what works. So I don't necessarily have anything against the use of local remedies per se, but I want it to be done together with me whilst we monitor so we can see what is being done. That's one factor. The other factor is a general mistrust of big pharma and side effects, because there are drugs that has been on the market for decades and all of a sudden they're being recalled. So there's a general mistrust among persons for the use of medication. Then there's the other factor. When, let's say, for instance, I start my patients on medication for diabetes or high blood pressure, they don't like to hear that once they start taking it, they have to continue taking it forever. So they simply are hesitant to even start. So those are three of the main factors: of culture, the mistrust for big pharma, and the need to be on medication for an extended, if not lifelong period.
And I guess all of that, it adds to the hysteria. And if you just going to, let's say, revert to COVID, where now, so there's a general mistrust. I don't want to take medication to start with. There's a big mistrust of big pharma. I know you're saying to them, I have to take a vaccine. I have to take a first shot, a second shot, in some cases a third shot. And only this morning I think I was reading that the WHO, they've actually given approval to consideration in some nations where they, I know it's happening in the US and in Britain and those bigger countries, where they've suggested that elderly patients, individuals, should be given a fourth shot. It's not prescribed for the younger people, but they're saying for the elderly folks, because of course of their predisposed conditions, they're now saying they're recommending that they be made available for a fourth shot. I'm assuming, Doc, that all of these things, misgivings in people's mind, it adds to that ongoing contention, and it adds to that state of unhealthiness mentally for them.
Very correct. The thing with COVID is that it's a fluid situation. It's new, and we have to trust the science. We have to trust the studies. We have to trust our doctors. We have to trust the technology. And we have to do what we think is best, not just individually, because it's a pandemic. We have to do what we think is best for our communities. We can't just look at it in an individual level. Everybody is affected by your decision, by my decision. So yes, there's this trust. Yes, today it's 2 doses, tomorrow it's 3, the next day it may be 4, but it's evolving, and it's evolving rapidly. So the treatments and the plans are also evolving rapidly, but we don't make decisions lightly. We don't say, the World Health Organization doesn't just say, you use this. It's studied, it's researched, it's read. Before I recommend anything to any of my patients, I read the data as well, before I can even recommend. So we don't make these decisions lightly. We don't influence you to put things into your body lightly. So it's just about trust and trusting us and seeing the danger of the whole situation and trying our best to get out of it as quickly as possible with what we have available. And what we have available is working. The evidence shows that it's working in different parts of the world. So we need to get on board.
We have to take a quick commercial break, but while you on the break, a comment coming in via social media that we will tend to we'll offer your response after the break, where they're hinting that it's not just a case of not wanting to take medication, but somebody's pointing to the fact that in many cases it adds up to the issue of affordability. We'll attend to that on the other side of the break. 20 minutes gone past the other. This is To The Point for today, Wednesday, the 13th day of October. We'll be right back.
Let's get tough on breed your larceny. It will destroy our economy. Larceny threatens our food security. Can hurt us locally, hurt us globally. To all the buyers, ask for license from our produce sellers. To all the people, 300 for police for them thieving fellas. To all the farmers, don't steal produce from your brother. Then you're selling to traffickers, hotels and street vendors. Nah, man. Let's do all we can to stop radio larceny. New vigilance, new laws, and a tough judiciary. Stop Grenada's organized business crime. It's time.
To report pre-deal larceny, call 300.
As we mark World Food Day 2021, under the theme, our actions are our future. Our farmers, our fishers, we must continue to be involved in sustainable agriculture, sustainable fishing, such that we can ensure that we can have livelihoods into the future. Ask of us to be involved in activities that can increase our revenue through our exports. At the same time, we must ensure that we can feed this nation for our food security. In this way, we would have increased production and improvement in our livelihoods. At the same time, I'm calling on our nation, on our citizens, that we must support our local products because it is safer, we know where it's coming from, but it also has a lower carbon footprint because it is grown and consumed right in Grenada. In this regards, we would be able to have a better life, we would be better able to be healthy, and we would be able to live to see many more World Food Days in this world. This is my message to this nation.
Between 80 and 60, you have to pay, but it's heavily subsidized. So something that may cost $50 at the private pharmacy would cost $5 at the government dispensary.
Okay.
So usually it's available. Sometimes because of shipment challenges, it may be low on stock and you may have to buy a week or 2 weeks supply of your chronic drugs, but they generally do come back on stock quickly. So you just come back in and you fill up with us. And we tend to try to prescribe what is available as much as possible on the OECS formulary. So we shouldn't make affordability the biggest problem because most, if not all of what we try to prescribe are available at the public level. An issue is that if you go to see a private doctor with and you get a private script, it would not be acknowledged at the public health centers. So then you would have to go and buy it in the private pharmacies. And so maybe people just need to use the public system more. Come to the medical stations, use the government dispensaries so they can avoid that high cost that they're talking about.
There's the issue of cost, and there's also, I was privy to a situation with only about 2-3 weeks ago where someone was given a prescription and they went to the pharmacy and only to realize that for the first 3 drugs that that particular doctor prescribed, most of the pharmacies on island were saying they don't carry that drug. And They then had to make a couple trips back from hospital, back to the pharmacy. Is that a regular? How much of a concern is that for you as a health practitioner? Is that something that you come across on a day-to-day basis? And what do you think may be responsible for that? That it is prescribed by the doctor in the hospital, and the major pharmacies have said, we don't carry the drug. We have a substitute for it, but not that one.
Well, sometimes that happens based on the condition and what we're treating. But we don't have off the top of our head a list of what is available at all the pharmacies. So we would prescribe. The pharmacies usually get back to us if there is a problem or they don't have what we want and ask if we would like to recommend something else. And there are substitutes, there are second line options, there are other options that we would then change to if it's not available on island. It does happen, but it's not that frequent, and there are ways around that that we can manage to get the patient on the appropriate therapy. So there are ways around it.
Another good another good commendation coming in via WhatsApp. And as they come, I'm going to take them. And the person says, good morning. I'd like to join the folks that are saying thanks to Dr. Renaud. I am not in a district per se, but I did have prostate checks with her. And she's a German lady and a doctor. Once again, thank you, Doc. And continue doing the great job that you're doing. May God bless you and your family.
Thank you.
It only goes to show, Doc, that it sometimes seems as though it's an ungrateful industry that you've chosen. Do you ever feel that way? Like, really, why did I do this? These ungrateful people, they never say thanks?
Once in a blue moon, if somebody acts up badly at the medical facility, once in a blue moon, but it quickly blows by because I know I am doing this, I know why we're doing this, and it's really what we love. So it's not the overriding emotion at all. Once in a blue moon.
Once in a blue moon. Let's get back into it and let's talk the COVID. One of the challenges you've heard the concern is that of home care for COVID patients. In the initial conversation with health officials was that if you have flu-like symptoms, that you go home and you wait it out, as they say, and if it worsens, then. As a district officer, as the DMO for St. Andrew, what would you advise persons to be the first course of action? If, and we're saying this, yes, while the numbers are going down, we keep saying we don't want people to become complacent. What should be your first course of action as an individual if you do recognize that you're coming down with those flu-like symptoms?
With the flu-like symptoms that might be COVID, or with a COVID diagnosis that's worsening?
Well, let's look at it both ways, because sometimes you're not really quite sure.
All right. So if you're coming down with flu-like symptoms that may be COVID, my advice to you is assume it's COVID. Seek medical attention, get tested, and get COVID ruled out. COVID is the danger here. COVID is the one that can spread to our vulnerable, the one that's behaving like a monster and taking so many of our people. So if you do come down with any symptom that might be similar to COVID, just assume it's COVID, isolate from your family and friends, reach out to us to see if we can come to test you based on your location and your situation, or if we can advise you on how to get to us so you can be tested. And then after you get a definite diagnosis, you take it from there in terms of the advice we give you after that. No, if you're okay, sorry. No,
I was just about to butt in. If you've positively determined that you're COVID positive, what should be the course of action?
All right. So if you're COVID positive and you're at home and you're experiencing worsening symptoms, reach out. There's a hotline. There have been lots of complaints of people not getting through to the hotline. I mean, I've been working the hotline. I've worked the hotline, but the hotline has its problems. I don't get calls. The calls drop, the calls cut off, so it's kind of difficult. So if you're not getting through to the hotline, call the medical station if it's between the hours of 8 to 4 or 8 to 8 in some districts. Call the hospitals and get advice. Patients have called Princess Alice. They've been assessed by the nurse or the doctor. They've called me from Princess Alice, given me the patient's numbers. I've called them and I've assessed them, and it works. So just call. Find a way to reach out to us. And if you're really not getting to us, then get in a vehicle and go to the hospital or come to us. We can't turn you away. We have to see you. We would see you. So if you're trying to call and you're not getting through, then come.
We
Don't
continue.
stay home and get worse. Come.
Then there is the conversation again, as we've hinted before, that preference or that love for home remedies. Your thoughts on that, Doc? More and more you've heard about the conversation about steaming, using this, using that. Your thoughts on it as to how should you just strike a balance? What should you do? What should one do?
All right. So most persons experience mild symptoms, as we know. And I have absolutely nothing against using your home remedies if you're experiencing mild flu-like symptoms. Your big time bush tea for the cough on your chest, once it's not that bad, your steaming, your bush tea, your juice, your vegetables, your fruits. I have absolutely no problem with using your home remedies. But the caveat is that you have to know when it's not working and reach out to us for help. So if you notice that you're drinking this thing for the cough and the cough is just getting worse and you're getting short of breath, then it's not working. Don't say, oh, it's going to work because it has always worked. Call us. Come to us and see how we can help you then. Don't wait until it's really bad to come to us. So I'm not gonna come down on anybody for using the home remedies. I've advised my patients with mild symptoms to use the home remedies, but I've also advised them to reach out to me and to reach out to us when things don't seem to be improving.
Doc, I want us to I'm not sure if you have it in front of you or you're acquainted with it, if you've seen the latest COVID dashboard as of yesterday, but a question coming via social media. If you look at the map, and I'm hoping, do you have one in front of you? Or are you acquainted with it in your head? There is a portion.
Dashboard from yesterday.
Okay, there is a portion of the map that is the Grenada map that is in yellow. Mm-hmm. Right. So somebody's asking, can the doctor explain the yellow parts of the map and why there is no column that says how much died after taking the vaccine?
The yellow part of the map, to the best of my knowledge, indicates the percentage of eligible population that's fully vaccinated. In terms of the number of persons that have died from taking the vaccine, I am not aware of any post-vaccine deaths in Grenada. So I cannot speak on that.
Well, maybe just to add to it, under the total death column, which as of yesterday was at 184, it shows that 94.6% percentage, there's 94.6% represents unvaccinated persons. But what is interesting, Doc, I'm not sure if you've paid attention to it, when COVID started, the percentage unvaccinated in terms of the deaths, it was much higher. Under the fully vaccinated, the total death column, I'm noticing that the fully vaccinated column and even partially vaccinated column, those two continue, they are increasing as well.
All right, so as the pandemic evolved in Grenada and we got into a level of community spread, more and more persons became infected. Among those persons are high-risk persons that would have taken the vaccine or that had taken the vaccine, are those that are partially vaccinated. So as the numbers increased, more persons got sick. Naturally, logically, among the sick, there would be some persons that were vaccinated because they have other risk factors and other things that would predispose them to severe disease. So there would be one or two of those breakthrough infections that become severe in persons who are vaccinated, and we would start picking that up as more numbers of persons will have become infected with COVID. So it's logical, it's natural, it's what we expect to see. It's known that COVID doesn't offer 100% protection from severe illness and death, but it does offer a high percentage, and that 2% that is not protected might somehow be reflected in those statistics for the partially vaccinated and the fully vaccinated that died. And I believe, if I'm not mistaken, that some of them were some of the elderly that had severe underlying conditions as well, or some persons that sought help late. very late. So it's expected. It's not sinister.
Do you think is that sort of lack of knowledge that gives rise to people that would add to the hesitation when people start looking at these figures and not appreciating exactly what's happening, that they would probably say to themselves, well, if the unvaccinated and partially vaccinated persons, if their death rate is increasing, then why should I? Do you think is that misperception, misunderstanding of what's happening, that is something that continues to give rise to that sort of hesitancy?
Definitely. So I like the fact that they've expanded the dashboard to include more data. And education is key. So this programs with Dr. Noel and Donna, where we explain some of the statistics, Dr. Mayano Charles, some of the data on the dashboard helps people to understand. But I've noticed that a lot of persons are closed-minded. No matter how much you try to explain to them what the information is saying, what the information means, they are stuck with what they want, and they let that out to the public, and they continue to create the confusion. But it's just about education and understanding. And ask us. If you've had my patients, they call me all the time and ask me, Doc, what does this mean? And so on. So just ask, reach out to the healthcare provider that you trust, and just ask for a little explanation on what's happening. And then maybe that will help you to ease your mind and understand better what's going on.
But as we are continue to smile that we at a point where we can say to ourselves that things are looking on the up in terms of the number of active COVID cases. We keep hearing about underlying conditions, and I want you, Doc, to make that practical connection for me, because somebody may probably ask, okay, so I'm diabetic, I contract COVID. COVID is a respiratory ailment. And they may ask, what does a respiratory ailment have to do with anything about the amount of sugar that's in my blood and how my body processes sugar? And what does it have to do with anything that I now become at greater risk because of those underlying conditions, be it me being hypertensive or being diabetic?
All right, so just the fact that someone has a chronic disease means that they are immunocompromised to varying extents. The more controlled your disease is, the less immunocompromised you are. But the toll that these diseases take on your body as it tries to control it, as it affects your organs, leaves you in a state where you're more vulnerable to infection. Now let's take somebody who's diabetic, for instance, who's not controlled normally. Stress is a trigger for getting diabetes uncontrolled. COVID, a respiratory illness, is a stress factor on the body. So your body doesn't function, the lung for itself, the kidney for itself, the liver for itself. It's a whole. So every organ affects the other. So that respiratory illness, COVID, it stresses your body, which in turn disbalances your glycemic levels, your blood glucose levels. So it makes it worse. It's like a vicious cycle. You're diabetic, so your immune system is compromised. You get an infection. That infection makes the diabetes worse. And it's just really hard for your body to catch up with that. That's why it's so important that you get your underlying conditions under control prior to contracting COVID. If you're that you try your best not to contract COVID in the first place, because it's added stresses to an already stressed body. And
as we talk about stress, Doc, do you think enough effort there's been enough effort by our health officials to give the population appreciation? Because COVID, naturally, you talk about the impact of stress on the body, what it does. Now you have the case where COVID, people have to deal with whether it's a death in the family, we've seen it, the out of jobs, the challenges with children learning remotely. It compounds the problem. Do you think enough has been done by health officials to address that component of what has been added to our ongoing crisis?
Right, so we're talking now about the psychological stresses of COVID. Is enough being done? Probably not. What is enough, given the context that we're living in?
But no, I'm asking in the context that every day you keep hearing take your vaccine, and that is fine. That seems to be the focal point of the conversation. But as you hinted, and we all recognizing that, yes, while this has to be done, there is that other side of COVID. Only yesterday as well, Dr. Noel was saying, he was talking about what he called it, long COVID, that he calls it. People having to now prepare themselves to live with some of the effects of COVID, and the mental component of it. In many could be in many cases, that's what's driving a lot of people towards the hospital. So why then now do you think that, having recognized that enough is being done to say to people, listen, keep your mental check, your mental balance in check?
You see, to say that enough is or is not being done is being judgmental. So I don't want to go down that line. What I would say is that we could always do more. So we have to, when we discharge a patient from COVID, we need to remind them of the other effects, of the psychological effects. When a person is diagnosed with COVID, we need to be available to them to hear their concerns. And the psychosocial unit of the Ministry of Social Development, I know, is available 24/7. Maybe a lot of the public doesn't know that, to reach out if they need to talk to someone. Your doctors, your nurses are available to talk to all the time. So maybe, not enough is being done to let the public know that there is counseling and there is psychological support available, and that it's normal to feel overwhelmed and feel anxious and feel stressed by what is happening, but that there is help and that it doesn't have to last forever. Maybe we can start focusing on that a little more as we're emerging out of this first wave. But one area of focus doesn't have to take away from another area of focus. We can do all of it.
Indeed, because I think there's a lot of persons that are a bit fearful that maybe what happens on the other side of the pandemic. COVID as it is. So we keep talking about the second wave. What would you advise to the general public? But even while we get that, somebody's asking, what is your take on the use of ivermectin?
All right. Now, ivermectin is an approved drug, an essential drug for a lot of parasitic infections at a certain dose. Now, in terms of COVID, there are some studies that say it's working, others that say not. There are reviews that say some of these studies are not acceptable. So there isn't a stance on recommended for or against ivermectin for treating COVID. So there are clinicians, there are doctors that may think of their particular patient and say, okay, based on the course of your disease and based on what's happening with you, I'll try ivermectin, I'll prescribe it for you. And that is a clinician-based decision with their particular patient. So what I do say is that there's no recommendation for or against prescribing it. A clinician and a patient may make the decision to try it, and that is individualized. But as for now, there is no standardized recommendation for or against use of ivermectin. So we cannot have it as a one-stop treatment for everybody with COVID. But you and your doctor on an individual level can discuss it and see where that leads you in terms of your treatment plan.
And I guess whatever happens between the doctor and the patient stays between the doctor and the patient. And I'm assuming that if a patient goes, I go with the prescription to the pharmacy for the drug, they are going to provide it to me.
They may have because of the recommended dosing that I have read for ivermectin, it's a bit higher than what is normally given for other parasitic infections. So they may call the doctor with a concern as to the dosing and the duration of the therapy and so on, and the doctor and the pharmacist would have a conversation. And I guess rightfully the pharmacist should dispense it, but if it's against their own personal judgment and they don't feel comfortable dispensing it, then they're also within their right to not dispense it. So it goes down to the conversation patient, doctor, pharmacist, and what is decided at the moment. Personally, I have not had to recommend or treat any patient with ivermectin. I've had patients ask me for ivermectin, and I've given them my rationale for not giving it to them. And they've gotten better without the ivermectin. There might be doctors who would have prescribed ivermectin and their patients would have gotten better with the ivermectin. So it's still in the let's see what happens phase in terms of ivermectin. So I'll leave it at a decision at the level of physician and patient. It's not mandated nationally. It's not on the formulary for that. It's not approved for that. So patient and physician.
Patient and physician. More and more persons, Grenadians, they're moving in that direction of natural treatment, and we're not talking about any natural treatment, but people are looking to their herbs, their ginger, their lemongrass, the big time things that we know that have its health benefit. So, for example, ginger we know is an excellent source of zinc, and the doctors are recommended. What would you be concerned that, or what would you say to an individual in the post-COVID period? Are you fearful, or tell me your advice, where a person may think, well, I've gotten better now, let me abandon all those good practices that I have adopted? Or would you, as a doctor, I know you said you don't have no reservation, but would you think that it should now serve as a more nationalistic campaign whereby we encourage individuals, now that they seem to be gravitating to it more and more? Listen, folks, you're on a good path. Continue with the fruits and the vegetables. Continue taking the bright colored ones. More cabbages, more carrots, more ginger. Would you encourage persons in the post-COVID pandemic period to continue along that path?
Oh, most definitely. The Food and Nutrition Council and the Ministry of Health for years have been trying to get people along that path. Now we have a golden opportunity where COVID has forced a lot of us along that path. So we have to ride that train and continue to encourage it and continue to have people follow the healthy lifestyle, use the healthy foods, the physical activity. We need to keep that train going and go with the momentum to keep people along that path, because it definitely will help in the long run in terms of the development of chronic disease, the management of chronic diseases. So most definitely we need to keep along that healthy lifestyle path that we've started to adapt because of COVID.
We're keeping our eyes on the clock, 12 minutes on to the hour of 10 o'clock. We take a quick commercial break, Renaud. When we come back, we get into the wrap-up conversation for today's edition of To The Point for the 13th day of October.
World Food Day 2021. The virtual event showcases our food heroes, modern technologies in agriculture, and ingenuity of agro-processors. Celebrate with us our achievement, creativity, and explore the many opportunities in the sector. Be entertained by the best of our cultural extravagance. Join us October the 15th via Zoom, GIS, and Real FM. Visit the Ministry of Agriculture's Facebook page for more information.
Welcome back to The Point. My guest this morning is District Medical Officer for St. Andrews, Dr. Renaud. Doc, we're almost out of time, and you're almost officially off the hot seat. That should probably allow you to breathe a bit easier. I want us to just spend the next few minutes talking about home care in the context of getting it right. Because even in the mix of whatever medications you're using, you certainly want to be able to make sure that the person is getting the right balance in terms of sleep, exercise. Re-emphasize the need for a balanced approach to dealing with COVID as we go forward.
So with COVID, we need to treat our entire system, our mind, our body, everything. So the basic treatment is rest and hydration and a healthy diet. So if you're diagnosed with COVID, I know we tell you to isolate, but that does not mean you have to lie in a bed with your windows closed all day. No, you open your windows, you get the fresh air, you get the sunshine. If you can go outside with your mask on by yourself, you take a walk around, you come back in without exposing anyone. You need to remain physically active. You need to eat healthily. You need to have your family prepare and bring for you healthy foods, your fruits, your vegetables, and a lot of hydration, I encourage my patients to maybe squeeze a little lemon in their water, a Gatorade. Some people lose taste and smell, so it's hard for them to eat. But you still have to make a conscious effort to do that, and especially the hydration. And then the rest, you sleep, you get your 8 hours of sleep. You can use the time to read, to relax, look at movies, anything that you can do to relax, catch up with friends on video calls. But you need to take a holistic approach. Rest, diet, physical activity, and whatever medications your doctor may recommend.
And that sort of balance should also apply for children as well.
Of course. Now, with children, the parents have to care for them, so the parents have to take the lead. Yeah, but of course, it applies to children as well. We encourage them.
You talk about sleep, Doc, from a professional standpoint. Put into perspective the importance of sleep and the impact that it has on one's body.
Okay, sleep is your body's natural way of resetting. So after you go through an entire day of physical activity, of mental activity, you become tired. Your mind becomes tired, your body becomes tired. When you sleep, your body gets the chance to rest and reset, so you get up rejuvenated so you can start again. Sleep is as important as food for the human body. I know on nights when I don't get a good sleep the next day, I struggle. I have migraines. I have to hope that the adrenaline of the day keeps me going. But when I get a good night's rest, it's a lot easier to go through the day because my mind is refreshed, my body is refreshed. So to me, sleep is as important as food and exercise for the human body, especially for children.
It is. I was just trying to check to see what's happening here on Facebook to make sure that I didn't miss anyone. In case you were just joining us, we at the latter stage of To The Point for today, the 13th. My guest is District Medical Officer for St. Andrews and Dr. KerryAnn Renaud. And we've been just talking about what's happening on the district level. Before we wrap, let's just talk about the importance, Doc, of preventative health care, not just at the district level in terms of the professionals, but in terms of us as individuals, how we change our attitude towards healthcare.
All right, preventative healthcare is essential, and that's what community health is about, tackling disease before you get to the level of disease. So it starts with your lifestyle, physical activity, trying to reject that sedentarism that we're getting used to with the TV and the Facebook and the phone, proper diet, leave out the junk and eat more fresh, healthy fruits and vegetables, everything in moderation. Of course, one day you might want some chicken and fries, nothing wrong with that, but we cannot depend on chicken and fries every day. So we look at our healthy diets, activities, and very important, our annual medical checks. A lot of Grenadians wait until something is wrong to go to the doctor. But if we do an annual check, and we check our blood pressure, we check our blood sugar, we do our weight, we have a conversation, we do our labs, we look at our family history, we look at our risk factors, and we talk with the doctor, we can prevent or catch a lot of diseases very early before they cause havoc on our bodies. So yes, preventive healthcare is fundamental in primary healthcare, and it starts on an individual level. And I just want to encourage Grenadians to use your health services. There is a doctor available to every single Grenadian. So those who can't afford to pay their private physician, we are available at the health center. So every single Grenadian has access to an annual medical check. So we need to use that.
It's interesting that you said that every Grenadian, so we have no excuse. So the issue of costs should not necessarily be an issue.
it shouldn't be the underlying issue. Something may come up that may cost you, but there are social nets and there are programs that can help you. But you wouldn't know that if you just sit back and say, I can't afford it, so I'm not going. So approach us. We're there and you have access. And there are ways to get around the system. There are ways to help you. There are ways to use the system to help you. So let's get on board with our health. Let's do our annual checks. Let's eat well. Let's exercise. Let's rest. And let's promote a healthy Grenada as we get out of COVID.
Yes, we do our annual checks, but you would also highlight the importance, underscore the importance of always knowing your numbers.
Yes, definitely. In your annual check, you get your blood pressure checked, you get your blood sugar checked, and you don't even have to wait for an annual check. You can just walk by the medical station and say, hi nurse, can you check my blood pressure for me? Once every couple months, they do it. Your blood sugar, they do it. Know your numbers. Definitely, Mr. Cadore, know your numbers.
Before we wrap, do you think that people, the general public, understands and appreciate the role that the district doctors and district nurses play as it relates to the whole conversation of healthcare? Do you think people really appreciate and understands the role?
I don't think so. I think the service is underutilized or utilized wrongly. People go to the emergency room for things that they can come to us for. People only come to us if they get sick, whereas we're there for your annual checks. No, I don't think it's fully appreciated. So more can be done in terms of the health promotion and education. I know the Ministry of Health had been working on that. So maybe as COVID came in, things got interrupted. But hopefully we can get back on stream as things normalize.
Hopefully we can get back on the stream as things normalize. That's my final thought from you. My guest this morning, in case you just chiming in, was District Medical Officer for St. Andrew, Dr. KerryAnn Renaud. Thank you, Doc. All the best to you, and continue to do the great job. And I think I can join my voice in saying great job based on the comments that I've seen coming via our social media platform. It only shows that what you're doing hasn't gone unnoticed. Continue to do what you're doing.
Thank you, and thank you for having me.
Thank you. All the best to you. 5 minutes onto the hour, 4 minutes actually onto the hour. 10 o'clock. It's the time when I get ready to say goodbyes to you. It certainly has been a pleasure being here with you. The man GT comes to take you forward bang for the next 3 hours onto 1 o'clock. Peace and love. GC loves you. The good Lord's willing, I'll be back with you tomorrow morning from 6 o'clock. Continue to do what you have to do to be safe. Take care of yourself. God bless.